Our next session I am especially excited about, as it includes a voice who I have followed since the beginning of this pandemic, and I suspect someone who many of you are familiar with as well. So this session is communicating nuance during difficult times, like a pandemic, and I'm thrilled to announce, or to introduce rather, Dr. Monica Gandhi, who is an MD and also has a master's in public health. She is an infectious diseases and HIV doctor at the esteemed University of California, San Francisco. In fact, there is a fantastic profile of Monica in the San Francisco Chronicle, I believe by Ryan Cost, on October, it was, I think, published on October 17th. So I recommend you all read that to get a little bit more background, but I'll tell you all the headline because it'll help shape our discussion. The headline is Monica Gandhi is San Francisco's outlier COVID expert. Her view on it, I'm not saying anything crazy. So joining Monica, we also have the always insightful Emily Poe, who many of you know is the group president of integrated communications at Real Chemistry. Welcome, Monica and Emily.
Hi, thank you.
Thank you.
So Monica, I cleared it with you right there. I can call you Monica.
Yes, yes, please.
So I am one of your 71,000 Twitter followers, and you're one of a handful of Twitter accounts I check every morning. And that was especially crucial for me, and I think a lot of people in this point in July, right, when we sort of thought we were past the worst of it, and then suddenly this Delta variant's emerging and everything that we thought we knew was just sort of, turned upside down. During that moment, it felt like healthcare experts, whether as epidemiologists, even policymakers, physicians, there was so much conflict. Can you describe what that moment was like for you?
Yes, I mean, I think we were surprised by the Delta variant, except for the fact that it actually followed a pretty clear pattern, which is that in places with higher rates of vaccination, states, so we can see our country as 50 different states, places with high rates of vaccination, the hospitalization stayed low and manageable, and places with low rates of vaccination, the hospitalizations went high and followed the case curve. In other places, the cases went up, but the hospitalization stayed low. That is really consistent with immunology, that when you have immunity, your antibodies will come down in your nose, which protects you from mild infections, but your T cell, your B cell immunity, and especially T cell immunity is still there to protect you from severe disease. So I actually think we did follow a pattern that looked like Europe, like a patchwork of places in this state, in this country, but since every state was experiencing it differently, it was hard to communicate one thing about the Delta variant.
In terms of messaging, right, in that moment when it did feel like there was conflicting messaging, right? I mean, even when the CDC said masks, no masks, and then with a rate of transmission for vaccinated people, that was in flux. There was a moment where I don't know, there was many panicked text messages between vaccinated people, just, wondering like, how much of a risk are we? So what was your advice or learning around how to, or like, what do you think if you could do that again, or you could advise the CDC or whoever else to do that again, what advice would you give them about communicating when there are so many unknowns?
I think, I did get worried about how they communicated around that time, because the reason is that there was this Provincetown outbreak, and they messaged that vaccinated, just the very phrase vaccinated people are equally likely to spread as unvaccinated, had no nuance to it whatsoever. And that phrase is taken out of context and was a soundbite. That's not true. Symptomatic breakthroughs are more likely with Delta to transmit than Alpha. And it's really complex. It has to do with your antibodies going down in your nose so you could pass it on more readily if you were sick. But it didn't mean that they were equally as likely to spread, especially if asymptomatic, vaccinated, and careful contact tracing studies have shown if you're asymptomatic and vaccinated, you're not spreading it. And what that did is terrify the vaccinated, in my opinion, and it made unvaccinated people think the vaccines don't work. And then when you actually tried to impose vaccine mandates, which the Biden administration did in early September, which I supported, it's very fair for someone who doesn't want to get the vaccine to say, if I'm not protecting others, and the CDC said I wasn't, you can't make me get a vaccine. I'm going to take on my own risk. And that, I think, was one of the most fearful messages, it was ill conveyed by the CDC.
Right. And Emily, I'm curious to know from your perspective, because you're counseling clients on a regular basis, when there is conflicting or ever changing information. Yeah. I think it was more that the data was changing, and there is a lot of nuances, as Monica was describing, right? I mean, while there was transmission amongst vaccinated people, we learned later, right? They were clearing the virus more quickly. In some cases, if they were asymptomatic, then I think it's still questionable in terms of how transmissible it was for them, or contagious. So Emily, when there are all of these unknowns, what guidance do you give around messaging?
Yeah, the guidance that we would always give is to be transparent about what we don't know and don't know, right? The CDC was giving guidance from a place of caution, and however, what we needed to say at that time was, look, we don't know all of the facts. And that's what we would tell a client to say. We don't necessarily know all of the facts. We are gathering data right now. Right now, our best recommendation is to do, wearing masks while vaccinated, because we don't know yet. When we get that information, we're going to share it, and then we will adjust our recommendations. Just like any other communications, being transparent, being clear, being simple with your messaging, and not having mixed messages without explaining why there are mixed messages can confuse any audience, and certainly at a time when people are so scared, concerned, and worried, and there's so much other information out there. That definitely confused the issue much more than it probably needed to.
So Monica, I want to talk a little bit about your background in HIV/AIDS and make some parallels. But before I do that, just because you did address the dangers of getting it wrong, and to your point, right? I mean, we ended up in this place where the vaccinated were terrified, and the unvaccinated, yeah, I mean, just so we're questioning the utility of getting the vaccine. I want to explore that a little bit further in terms of the danger and risk of getting messaging wrong. I mean, you've been called an outlier voice in the Bay Area, where both Monica, you and I live. As for those of you that don't know, the Bay Area, it's 9 counties that make up the Bay Area, and they, I think, have been the most cautious in the entire United States. I think we were the first to go down and go into lockdown. We are one of the few that still have indoor mask mandates. And as a medical professional, you kind of, a lot of folks sort of see you as kind of this balance between reassurance and also sort of being candid about risk. How do you balance those two things, providing some reassurance and also, being open about the risk, and without getting backlash that you're marginalizing or, putting blinders around what the potential those risks are?
I mean, I think that there definitely, COVID-19 is a really scary pandemic, but I didn't anticipate, I think, well, maybe no one anticipated it would go on this long, and not putting risk in context of other risks, like the risk to children of not being in person learning, or the risk of not being together, or social isolation, or depression, or anxiety. It felt like, and you were going to ask about HIV, it felt like the beginning of the HIV epidemic, where I was present, not in 1981, but present later. And we didn't know how things were spread. So we did everything to say caution. So we said oral sex and kissing and saliva, and everything was risky. And then we refined the messaging, but it took years. And it scared a lot of people. And I don't think that COVID-19 is transmitted by every interaction. There are certain interactions that transmit it, and indoor more than outdoor, and masked less than unmasked. And so there was these nuances. And I think just in the name of caution, we didn't want to say those nuances because we had the means to stay at home. The Bay Area had more of the means to stay at home than some people in the Bay Area. And so the message appealed to the Bay Area because we had more people who could work at home and stay at home and had the means. And this is a very rich area of the country. So I think the message appealed, and my message didn't appeal. which is okay. And you know, this thing will end and I'll get off Twitter.
Right, which there's been a few times where you've thought about sort of stepping back, but I think you always come back, don't you?
Yeah, well, I actually have always worked with really vulnerable populations. So one other thing that was really different is that every single week I would see in my clinic people who are poor and people who are marginalized and stigmatized for having HIV, and the loneliness and the degree of substance use and the degree of overdose deaths that we saw. It was, I think, maybe a little different than people who were in public health and didn't see patients during this time.
That's actually a really interesting point, and I just want to kind of, you know, call out to you know, what the profile in the Chronicle pointed out, right? That, yeah, I mean, the beginning of the pandemic was driven by, you know, like you said, fear, shame, and even like this really very similar to, I think, HIV/AIDS, a sort of abstinence only based messaging, right?
Yeah.
And there was, and I don't know if this has changed, but there was this embarrassment if you got COVID. It was like, what did you do, right?
Yeah, like, were you being unsafe? Yeah, and that felt very much like the messaging in HIV, like what went, you know, yeah, what awful thing did you do? And so that it was just so many reminiscences for me with HIV that I couldn't stop making those comparisons.
Yeah, I liked the quote, as Gandhi put it, made space for the profound need of intimacy and the profound need for people to be together. And, you know, and I would be curious to hear from either Emily or Monica on this point about like, you know, what you think the future is around the stigma around COVID, right? I mean, this is something that, you know, you can get at the grocery store, you can get stepping into an elevator, going to do your physical. Like, do you think that we are shedding that stigma around catching it, or do you think there's work to do? And if so, like, what do you think needs to happen?
I would say there's still a stigma associated with it. You know, I still get the daily emails from the school telling me that there are COVID cases, and you know, people are worried about saying that they have COVID and being kicked out of school, especially these are often kids who are asymptomatic. You know, if they probably aren't actually even spreading it all that much. And again, the risk of them being out for 10 days without an actual curriculum to follow is really challenging. So to Monica's point, there's definitely a risk associated with having people be out of society, out of their lives, their jobs. There are tremendous risks. And I think that we are still so focused on trying to manage down the pandemic that we still have this reaction. We're very reactive when we hear that someone has tested positive. And I think my perspective is, until it's fairly endemic in the population, that will still probably happen. I mean, there are plenty of things that don't kill you, like head lice, right? That cause tremendous stigma,
right.
and they're not, you know, there's very little harm attached to it. And so I think that there are a lot of different types of areas where, you know, we could continue to help destigmatize.
Right. And by the way, I'll just pause for a moment to just point out that, you know, just for our audience, you know, how different the US is in terms of its protocols. So like Monica and I are both in the Bay Area, where we have mask mandates at schools, and I mandated testing at school and indoor mask mandates. And Emily, you are based out of Texas, that
Yes.
has outlawed
mask mandates. Yes, and my kids' schools do not have mask mandates, so yeah, very different area.
Yeah, sure. So I mean, even within the US, right, the way that this messaging is landing and being interpreted is just, and I guess Monica, well, let's start with that first question about the stigma, and then I would like to get your take on, you know, living in a country where, like, I mean, you go, you know, to a different state and it's just a completely different set of rules. But I would like to get your take on the stigma around COVID.
Yes, I mean, I think, you know, the testing is a problem in the sense of how the tests pick up virus, because it's really different than when we test for HIV, which is an antibody-based test. The way that testing is done here is that it's a PCR test, which is extremely sensitive. And so a very little amount of virus in the nose, which may mean very little for both patient and anyone around them, will still ding positive on that test. And then the rapid antigen tests, which are better at that, they will detect a more infectious level of virus, can also have false positives the way that you, just like a pregnancy test can have false positive if you leave it out too long. And so it is actually a problem with our testing that we called everyone a case when they may have done exactly what their immune system is supposed to do. They see a little bit of the virus, they fight it down, and they can't spread it, and they're not sick. So I think I wish we had a different test from the very beginning so that this stigma wouldn't occur, because an asymptomatic child with a low viral load is not the same as someone who's sick in the hospital with a high viral load. And we didn't think enough about inoculum and dose, and so everything became a case. It's kind of actually what's happening again. What happened in California, we did have very high rates of vaccination, but we actually had high rates of natural immunity as well, because we had a terrible winter surge, which I do blame on the over restrictions, because we were an outlier in terms of how many restrictions we had. And there was a point in time where the rule said you cannot walk outside except if you're masked with another person from your household 6 feet apart. And that was the winter rule. And so people go inside, I mean, because they were lonely and needed to see each other, and it was the holiday. And so we had a huge amount of natural infection over the holiday, over last holiday, 2020. And then we had high rates of vaccination, and we do have a lot of immunity, I think, in California, but you may still see some virus in the nose, but marking the hospitalizations was really profound how much lower and manageable hospitalizations were compared to the winter surge. That's the vaccine. And that's how much they work. And that's why I want to tell people who are saying the vaccines don't work based on cases, please look at, like, the whole point we developed vaccines, you don't want people to get sick and be in the hospital, and that we're preventing it. This is a wonderful vaccine. So again, another problem with messaging, I think.
Well, so actually, so I'm gonna detour now, and since we're talking about vaccines now with this booster conversation, right? Where, you know, there's certain groups that have been approved for boosters, but I think they left it open and vague enough that, right, like at what point are you at there's high enough exposure risk that you should be getting a booster? Is it going into an office? Is it having to have dinners with clients? Like what, I mean, what do you think needs to be improved around this booster messaging? Because it is really confusing right now.
I think that was another kind of big, I think the two things that went wrong since Delta was the vaccinated can spread as readily as unvaccinated, which isn't true. And then the second was the booster discussion, because it was done with a lot of confusion. FDA, CDC, HHS were visibly disagreeing. Biden was visibly disagreeing with its own Federal Drug Administration, and it made everyone suspicious of everything. I actually just make it really clear for people over 65 immunocompromised, definitely get a third shot. And otherwise, think about it. Talk to your doctor. I'm not sure. I think our B cells and T cells, if we're immunocompetent, are working great. And so I keep it really simple. But yeah, they a lot of confusion.
Right. Emily, did you want to comment at all around the booster messaging?
I think exactly what Monica said, right? To keep it simple, because right. I think it has been very complicated. And I think we do know that there are some straight truths. And when you focus in on, we know this, people should behave in this way because we have data that absolutely shows that this will help you stay healthy. That's a clear message. And then there's always going to be gray zone in healthcare. We know that. So at that time, that is when people do need to spend the time to talk about the risks with their doctors. That would be a very straightforward message that we would advise any client to deliver, but certainly in this case is how we're talking ourselves, even to our own employees.
You know, so as we talked about earlier, right? I mean, depending on where you go in the country, there are different rules, different cities, in San Francisco, and I believe in Berkeley, you have to show proof of vaccination for a lot of indoor activities. It's not the case for, say, Oakland, right? I mean, so even within like our 9 Bay Area counties, it even varies. Then we go to Texas, where there's vaccine mandates are outlawed, mask mandates are outlawed. So how, at a federal level, in a country that has our vaccine rates vary from under 30% to over 80%, right? And depending on where you are, how do you message? How do you message when you have this much? There's this much dissonance, and also, of course, I mean, not even taking into account all the misinformation that's out there, and people are getting facts, and we're not all operating on the same baseline of information. So, like, I guess, Monica, I'll start with you. Like, if you were advising the Biden administration, what would you say to them?
Yeah, I would say that the misinformation they're trying to control, but it's very hard to control in the setting of the internet and the setting of social media, which wasn't there with HIV. And MDs going on the air and saying that the vaccines are dangerous is misinformation, because they're not. However, I think what we can control better from the Biden administration is positive messaging. And again, I know that I've been accused of being really optimistic and positive, but I also saw it with HIV that that if you tell people that pre-exposure prophylaxis gets them out of a condom, or treatment is a good thing, and they can go back to normal life, that was really motivating to take treatment. And so I know I've been focused on this since February 2021, to some detriment to my reputation, because I know it seems really positive. But I think the way to motivate vaccinations is to say that children should get vaccinated. Only a third of parents right now are planning on vaccinating their children for sure, according to Kaiser Foundation. A third are saying no, and a third are on the fence. And I think one way to get motivation is to say your children are going to be out of masks in the masked areas, and that they're going to go back to normal life when they get vaccinated. And so I've been really focused on that message since February 2021. Like, I wrote a paper that said, or a piece that said, message optimism, not doom and gloom about the vaccines. And I can't get that out of my head, because I think that's the best way. And the Biden administration is, at least over the last 3 months, doesn't seem to tell the blue states, I guess, that they're going to get back to normal life. But that's what other European countries have done. They said, you get vaccinated, normal life, and they are getting there. They are back. Many are back to totally normal life. So I would use positive messaging if I were the CDC and the FDA and the Biden administration.
I mean, do you think we've been at two extremes where there's not been off ramps for the places that still have restrictions, and there's been just like the Wild West, Emily, as you said?
Definitely. That's the problem with our country, right? Like, we are going to stay locked down for much longer than likely is merited by our vaccination and immunity rates. And other places opened up, and hospitalizations really rose high. So that discrepancy, the polarization in this country is profound, and we won't get through the next pandemic unless we work on this.
I want to talk about data for a minute. So, Monica, your positions, were grounded in data, but the backlash was still there and intense. And in our business, and really in any business, right, you're often told that the way to kind of make your case bulletproof is to sort of wrap it in data. What are the human limitations to kind of data-based arguments?
Fear. I mean, the human limitation is that it's true. I write these tweets in the same way that I've written academic papers. I always reference a paper or a preprint or data, and I always put like tables in and stuff. This is just how I think, because I've been in academia for a long time. But it doesn't address something that's human and emotional, which is just fear. And this is a scary time. And because I didn't appeal to fear, or maybe use fear as a way to stop interaction, I got backlash. And so you know what, I'm sorry that it went that way, but I hope that in the end of this, we can all come together, not feel so fearful about a virus that has differential risks for children and adults and older people, and really just be profoundly okay with that and see that as a blessing, as that children are so much less at risk, and get to a place where we put our children's needs that isn't necessarily just to avoid this infection, but everything else in their lives as well, because the mental illness in children was declared a mental health emergency just 2 days ago by the American Academy of Pediatrics. So it took a toll on kids to be so scared.
Right, right. Well, I mean, Emily, I know you and I have in the past talked about, data-driven communications, and did you want to comment at all on sort of what those limitations are as well?
Yeah, I mean, we start with data, clinical, medical, scientific data, and any communications we do. And it is certainly open for interpretation if people so choose to do so, right? So when we talk about data-driven communications, and when we've done this in the past, Arti, one of the things we've talked about is actually using data, analytics, or other ways of understanding why people might view information, scientific, medical, clinical information in a certain way, and trying to contextualize the medical information with an understanding of where they're coming from as people. And in some cases, that's not going to stop the fear. We know that there are some people who are just going to have their own perceptions and their own ways of interpreting information. However, if you can take into account the real experience that someone is bringing to bear into a conversation about a medical advance like the vaccine, and why they should take it, or why their child maybe still needs a vaccine, even though they've been hearing how children are less at risk. So really kind of understanding the questions and the lived experiences that people have when they come to a conversation that can be as charged as this, even when you have that data, that helps you to bridge from where they're at to where you need them to be to change their behavior.
So Monica, you've mentioned, how your positions have sort of been at the detriment to your reputation. And I'm curious, sort of having gone through what you have, what advice you would give to people if they are perhaps the voice that's out of step in terms of protecting one's reputation, and what do you see as your standing? I mean, do you feel like there was long-term damage that was done, or do you feel like this is something that, once we can kind of zoom out a little bit, we'll be able to understand why there were so many different perspectives?
I hope not. I think that this phrase voice of reason keeps on being applied to me, and I don't actually think that reasonable is a bad place to be. But it didn't use messaging to I guess scare people. And so I think it's reasonable. I'll just keep on doing the science stuff, and then I'll get off Twitter, and then I think I'll be fine. I actually work very hard in my real job, and things are going well in that space.
Yes, I mean, you are in the clinic every day, right? I mean, that's people forget that all these folks that are out there giving their perspectives, many of them have big day jobs. So I guess, Emily, I mean, what advice would you give? I mean, if someone, if you do have a perspective that might be out of line or considered to be an outlier, but that's still steeped in data, and that's still, it's like, to Monica's point, like, it's a reasonable perspective.
I say, Monica, more people want to hear from you, right? I think that we live in a time where we have to have credible, authentic voices that are passionate to help us get to the right solution as a society, as a group. I think we should encourage that discourse, reasonable, thoughtful, steeped in data discourse. I say stay out there, and
it's not that much longer. It is, we are approaching endemicity with the virus.
There's going to be something else, though, that I bet.
Yeah, okay, I'm not doing it after this.
People are going to want to hear your opinion on them. Okay, so I would
we have about just a minute left, so I'm just going to, Monica, one of the things, so I feel like we should at least address this. You mentioned in the Chronicle piece, right, that maybe it was who the message was coming from, right? And I think your quote was, "I'm a woman, I'm short, I'm of color. Maybe that doesn't have authority. Maybe it doesn't give people as much confidence in our unconscious bias society." I think Ryan says, she doesn't sound hurt when she says this, more like she's guessing aloud. One piece of advice quickly, I know we have like 10 seconds, just one piece of advice for anyone else who kind of feels like their messages aren't being heard, perhaps because of who they are.
I mean, it would be strange because a man would say the same thing. Like, I think that you can, after you're vaccinated, you can feel safe. And it seemed like the same the same problem or vitriol wasn't applied there. And again, I don't actually think it was personal. I've experienced this from childhood because I grew up in a really pretty white place in the country in Utah. So I'm not hurt. I actually just think that we have to open up to our unconscious bias these days and try as hard as we can to just message without having bias.
Yeah, I think that's a good message. Just, be aware of your unconscious biases. Well, thank you so much, Monica and Emily. This was such a great conversation. I could have kept going, but I know we're at time.